first I wanted to ask you a little bit about some of the challenges of coming into compliance with this rule. So, on the surface, the way you've kind of explained it, it seems like such common sense for a member's data to follow them as they move to different health plans. It makes perfect sense, but of course, the devil is in the details. So, could you talk
hmm
a little bit about the challenges health plans face with exchanging member data? Particularly in terms of like the technical complexity, the costs, and of course, as always, resources.
Absolutely. There are so many challenges. I think that the biggest challenge that health plans are facing is that they have numerous interoperability mandates that are coming due, and each mandate is going to require time and resources to implement their respective APIs. And I'll be very blunt. If any health plans are listening to our podcast today, you are underestimating the time and effort and cost it will take to stand up these APIs and enable the workflows that they support. So you need to be thinking about solutioning for them. Certainly today, if not having already been thinking about this. And while there are implementation guides to help guide efforts, so there's the PDEX, for example, for payer to payer. There's standards bodies out there who are trying to put forward a standard way for implementation. We are finding that especially working with a few of our health plan customers on payer connectivity, that everyone's underestimating the work and level of effort and complexity involved, and that the guides are only going to get you so far because there are in fact gaps in them. And in addition to that, I do think too, specifically around payer to payer, one of the other challenges that many health plans are underestimating is this idea of managing dynamic payer catalogs and health plan authentication. So if you think about payer to payer and the idea of exchanging information between health plans, you are going to need to manage all of the different payer endpoints in a directory. And that is going to play a critical role in maintaining the accuracy and timelines of health information exchange across different healthcare entities. And these directories, I think there's tremendous value in acting as a comprehensive database that catalogs these various endpoints, each representing a different payer or health plan within a centralized network. But there are challenges when it comes to managing these endpoints, especially for large health plan systems that oversee multiple state branded plans. We were engaging in our first cohort with a number of these larger health plans. And oftentimes, the health plan name familiar to members differs from the parent company. And this discrepancy can make it really difficult to keep systems up to date and could complicate the process for members trying to find their previous health plan from, drop down lists that displays names of parent companies. And that's something that we actively discussed and talked through and worked with during our first cohort of health plans within our peer-to-peer connectivity hub.